Sciatica is really just a description of a set of symptoms referring to pain down the back of the leg. Now, there are a lot of different things out there that can cause sciatic-like symptoms, but is not necessarily classic sciatica. When we refer to the classic sciatica, we're referring to things that affect the sciatic nerve, which starts in the low back as well as the upper tailbone and comes down, and with its divisions, it feeds all the way down to your foot. Now, some of the things that can cause pain down the leg and in the hip are things like osteoarthritis of the hip, ITband syndrome, or even injuries to muscles like your hamstrings, your glutes, or your calves. A lot of times people are trying to do certain exercises for sciatica where it might be aggravating those, or vice versa, where they have sciatica and they're doing, piriformis type stretches and it's actually irritating the sciatic nerve even more. So classic sciatica really only affects one side. If you're getting pain down both legs and you're getting problems with your bowels and your bladder control, then you definitely should be seeking medical attention right away. What typically happens is there's an injury to the low back with classic sciatica, and what will happen is the nerve root associated with it will be irritated. So things like stenosis or central stenosis can cause that, but it's a little less common. Same with disc herniations, where you get a full-blown herniated disc and it's putting pressure or pinching the nerve. But the most common thing is when that disc, the outer fibers that are really hard, can get degenerative tears, and the wear and tear on that will cause inflammation, and that low-grade inflammation will irritate the nerve root, and you'll get intermittent bouts of this sciatic type pain. A good telltale sign and symptom is if you have this is daily activities that cause forward bending through the low back can be aggravating. So things such as putting on your socks in the morning, getting in and out of cars, or even just picking up your children can be debilitating at times and definitely aggravate the condition. What we'd like to do is work the opposite direction of what's aggravating it, and that's working to extension. So there's some very simple active extension type exercises you can do at home that take 3 to 5 minutes a day, depending on how much time you actually want to give these things, and they can help to alleviate some of the pressure in your low back and alleviate the residual symptoms as well. If you'd like any information on some of those, you can find some links in the description below, just showing some simple exercises that you can do, and I guarantee you will not break a sweat doing them. Now, the last thing I want to touch on is something called centralization, and this is a sign that your condition is getting better. So what that means is if you have nerve pain coming from your low back and that pain goes all the way down to your calves, and then you're under care and getting treatment somewhere, or you're doing daily exercises at home and stretching, and a week or two later it's only going down as far as your glute area, that's a sign that things are typically improving. So if you're on that path, then continue doing what you're doing. If not, and it's continuing to stay aggravated, then maybe it's time to switch things up a little bit or seek medical advice. So hopefully this helps you clarify if you have sciatica or classic sciatica or not, and if you do, hopefully you get better soon.